and I will be starting. I want complete science, and I will be starting with some introduction. That there are many vascular diseases which we will be discussing in today's lecture. The two main diseases which are the origins of most of the retinal diseases, most of the retinal vascular diseases are diabetes mellitus and hepatitis. And of these two, diabetes is a disease which directly affects the retina when the patient has been diabetic for at least 10 years, and we call it diabetic retinopathy. So first we will briefly study, because the time is limited and I have this duty to complete in the due time. Briefly, what is diabetic retinopathy? That is how it affects the eye. It will be followed by what vascular disorders patient might experience with the basic causes of diabetes and hypertension. So, I will skip some slides from here we will start. ये स्लाइड बड़ी इंपॉर्टेंट है, इसको जरा ध्यान रखें। ये बेसिस है डायबिटिक रेटिनोपैथी के की आगे की सारी। पैथोजेनेसिस सबसे पहले क्या होता है? फर्स्ट सिम्पटम और साइन इज हाइपरग्लाइसीमिया। ठीक है? After hyperglycemia, there is intracellular sorbitol accumulation for free radicals. I hope you people know these things from pathology, just for real. Then it causes the accumulation of glycatic end products, disruptions of ion channels function, and protein kinase C activation. Then there are three possibilities: direct effect on retinal cells, like it damages the supporting cells of endothelial vessels of the retina. Supporting cells like pericytes. For example, if you talk about retinal diseases, to each endothelial cell, one supporting cell, that is one endothelial, so each one endothelial cell, one pericyte assigned by doctor. The loss directly damages the pericytes. So when it is damaged, endothelium also becomes fragile. Second thing is microangiopathy. As diabetes involves the medium and small cell blood vessels, so the damage to the capillary walls can happen, and it can cause intraretinal hemorrhages, it can cause edema, it can cause microvascular effusions because of damage to capillary wall. समझ आ रही है? ये समझ आ रहा है? उसके बाद हीमेटोलॉजिकल चेंजेस होती हैं, वो भी माइक्रोवास्कुलर एक्यूलियर होती है, ब्लड वेसल बंद हो गई, इस्कीमिया हो सकता है, इंट्रारेटिनल माइक्रोवास्कुलर एब्नॉर्मैलिटीज, ठीक है? न्यू वेसल्स बन सकती हैं, न्यू वेसल्स के बाद हेमरेज हो सकता है, हेमरेज के बाद फाइब्रोवास्कुलर डैमेज होता है। ये ड्यूअल चीज है जो आप लोग अब तक सोच के तक पढ़ चुके हैं। मैंने आपको सिर्फ एक इसका a bird's eye view here from the perspective of ophthalmology. Now we will start the diabetic retinopathy. कुछ चीजें मैं छोड़ दूंगा। This is the classification of diabetic retinopathy after having known the pathogenesis. Again, I will emphasize two things are the main causes of damage being done by diabetic retinopathy. Number one, ischemia. Number two, leakage. Remember the take-home message of all the slide of pathogenesis of diabetic retinopathy is interact with these two words only, ischemia and aggregation. ये आप याद रखें। उसके बाद क्लासिफिकेशन देते हैं। डायग्राम डायबिटिक रेटिनोपैथी, प्री-प्रोलिफेरेटिव डायबिटिक रेटिनोपैथी एंड प्रोलिफेरेटिव डायबिटिक रेटिनोपैथी। ये सिर्फ तीन है। मैक्युलर डायबिटिक रेटिनोपैथी और एडवांस साइड डिजीज आपको लिखा है, क्लासिफिकेशन में ये तीन आती हैं। डायग्राम, प्री-प्रोलिफेरेटिव एंड प्रोलिफेरेटिव। अब हम देखेंगे हर स्टेज में क्या होता है। यहाँ तक एनी क्वेश्चन? एनी क्वेश्चन टिल नाउ? कोई नहीं? ओके, अब देखें, दिस इज नो वॉइस, नो वॉइस। This is these are microaneurysms. Can you see the red dots in the retina? This is a picture of the fundus taken by a fundus camera, which is showing the microaneurysm. And remember one most important thing: the first ever sign of diabetic retinopathy which anyone the first ever sign which anyone can find in a patient with diabetic retinopathy is the appearance of a microaneurysm. Even one microaneurysm should alert you that the patient might be having the diabetic retinopathy. So it is the first ever sign. Then you can see the intraretinal hemorrhages. As we all know that retina has 10 layers apart from the retinal pigment epithelium. The other 9 layers are of neurosensory retina. And the neurosensory retina has different layers, as you people know, like optic plexiform, hidden plexiform. इंट्रान्यूक्लियर और इस तरह के जो है न्यूरोसेंसिटिव रेटिना के अंदर ये जो हेमरेज होते हैं इनको बोलते हैं इंट्रारेटिनल हेमरेज। ये साइड नंबर 2 है फॉर स्टेज 1 ऑफ द डायबिटिक रेटिनोपैथी एंड स्टेज 1 इज कॉल्ड डायग्राम डायबिटिक रेटिनोपैथी। पहला था माइक्रोएनेरिज्म, दूसरा था इंट्रारेटिनल हेमरेज, उसके बाद ये रेटिनल एडीमा। This is the third sign of stage 1. After microaneurysm, number 1, intraretinal hemorrhage, number 2, retinal edema, number 3. You can see this is OCT, optical coherent tomography, and you can see the elevation. This is the normal, but it can be appreciated on clinical examination also. Then comes the hard aggregates.